So I'm from a family with a lineage from my father that has a genetic condition called, or a gene called polycystic kidney disease. And I knew about this as a young man because my father had it, and he did various things to care for himself, and was a very successful businessman with a large shopping mall, development company. He was very involved in politics, went into government, served as the General Services Administrator under Jimmy Carter. We were liberal Jews in the South. My family grew up in politics. I got very involved, along with the whole family, in Jimmy Carter's campaign, primarily inspired by the need for Carter to provide an alternative and block the vehement racism of George Wallace. For those of you who don't remember that time, Wallace had been getting quite a lot of votes as an independent presidential candidate and also was a threat in the Democratic primaries. In any case, as a young man, I got involved and saw what could happen when someone goes from 0% in the polls to winning the office of the presidency. About that time, I was diagnosed with this condition. It took until my early 20s to find out. When I was diagnosed, part of the message was, you will either die soon or you might live a long time, and there's very little you can do about it. Well, the one thing I did do about it was to think about what I wanted to do with my life. And it did help clarify a number of things, and I just will evoke, as Ambassador Lewis has touched on, the larger spectrum of all the issues, and any of us who've been awake during our lifetimes have certainly come to the conclusion that the planet is on a very difficult and dangerous course. And I concluded that I should use the power and privilege that I had as a white North American male from an affluent family to use those tools, the power of business and finance and politics, towards the common good. And that if I did that, however many days I got to live, I'd be doing what I would feel good about on my deathbed when I looked back, if I had that opportunity. So I chose to move my career to Canada because of a great opportunity to work with a visionary inheritor of a substantial amount of resources named Carol Newell. And we put together a strategy that Dr. Ross really got me thinking about here, which was to take a long-term look at how to deploy financial resources towards systemic social change focused in one region. So we make business investments, charitable grants, support collaborations, leadership development, and capacity building with the hopes of influencing public policy and creating models of sustainability solutions long term. If you live in Vancouver, BC, you can't help but notice what it means to be in one of the wealthiest and most blessed places on the planet. And if you can't do it in places like that and in places like here, we have a real problem on our hands. So that's my work. I went along working a bazillion hours like most of you do, and knowing that death would come someday, as all of you do. And then in December, I've lost the date. In 2005, I was told that I was at 30%. Let's see, let me get this right. 2006, I was told that my kidney function had dropped to 30%. Well, people told me any symptom I felt was just aging. And I just kept going and figured there was 5 or 10 more years, and then I could think about dialysis and transplant or whatever the alternatives were. Unfortunately, by December of 2007, is that right? No, okay, I got it wrong. I'm sorry for that. Doesn't matter what year, but December of 2006, I was told that my function had dropped down into the 20s, and then by April of last year, I was informed that I was down to 15%, and it was time to either find a kidney or prepare to go on dialysis this year. Now, dialysis is a wonderful invention and saves many lives and helps many people in all kinds of ways. The problem was that I also learned or relearned that my blood type was B positive. And with a B positive blood type, the prediction was 12-year average wait for a cadaver kidney on dialysis. I didn't want to face 12 years on dialysis. I want to put in a mention here for the Canadian healthcare system because I'd moved my career, become uninsurable forevermore in the U.S. But as a permanent resident of Canada, accessible, equal, quality health care is available to everyone. So at least I wasn't thinking about my insurance and my life savings and my house and my children's future and those sorts of topics. But there was a lot to think about. How does one go and find a kidney? Well, I'm grateful to the modern times and social technology networking possibilities. One click of the email, and hundreds of friends and colleagues learned about my situation and circumstance. And I very politely, as a good Southerner, said, of course, no pressure, but could I have your kidney? And in July of last year, an old and dear friend of mine named Siobhan Robinson, who's sitting here in front of me, called me and said that she had made it through all the tests and had been chosen as the most qualified kidney donor for me. And that she was thrilled for the opportunity. Now, it pales in comparison to what you've just had to think about in previous talk, but think for a moment and consider for a moment, imagine what it's like when someone says, I will give you my kidney. So on we go to November 14th of last year, the 18th anniversary of Siobhan's breast cancer surgery, successful, to the day. And the good news is we had a super successful experience, both of us. We recovered quickly. My anti-rejection drugs have minimal side effects on me, only to add to my nervousness, sometimes a little anxiety, but minimal impact. I've been able to return not only to my full workload and passions, but I can see better, I can hear better, I can think better, I have more energy, and I feel better in every way, shape, or form.